In 2020, the COVID-19 pandemic took the whole world by storm, killing several people. When the situation worsened, more doctors were recruited by the Ministry of Health to handle a growing number of COVID patients. This morning, medical workers who worked during the pandemic received letter of termination from the Ministry of Health, ordering them to vacate their workstations. Now, through their leaders from the Uganda Medical Association, the doctors and nurses have vowed not to vacate their working premises until their salary arrears are cleared. Dr. Samuel Oledu, the President Uganda Medical Association, says the workers have spent months without payment.
But they've never been paid, just an allowance and even their salary for over 4 months. I've used the word over, for over 4 months. They've not salary. Now, we have colleagues who died because of COVID, and they were not compensated. This individual.
According to Dr. Oledu, the Ministry of Health and other responsible parties should follow the directives of President Museveni.
As Uganda Medical Association, because of the presidential directives last year, which were very instrumental, one of them was deploy doctors even up to health center. 3, deploy nurses. We would expect this policy paper to be presented to Parliament.
The medical workers have now given government an ultimatum to address their grievances. However, Ministry of Health spokesperson says they will be paid.
Because of the great engagements we've had with government and the great efforts government has showed up, we would push induction to indefinite. However, doctors had agreed that 1st of May, when nothing is put in the budget framework, induction shall be reinstated or reactivated. By the look of things, by the frustrations going on in health, it is clear indication that what we intended not to implement, we might bring it a little closer.
Their salaries are going to be ready before end of weeks, including their arrears.
The health workers have also revealed some of the challenges they faced while they were treating COVID-19 patients.
We carried people's buckets, having their poo-poo and urine every day. We changed their diapers, changing a diaper of a 70-year-old. You know the smell, it's not pleasant at all.
They now want government to reward them for their duties by paying them the salaries they owe.
In the past 5 months, people have not been paid their salaries. NSSF was last paid in November, and the team that was deployed from Walim and later taken on by Ministry of Health has never received pay since they received their contract from Ministry of Health.
Ministry of Health Publicity Emmanuel Ainebiona also responded to other queries raised by protesters.
Positions that have wage will be considered for those that are needed, that are critical. The rest will be recalled as and when there is need.
Over 700 nurses and 200 doctors are going to be affected if the directive of the Ministry of Health is implemented right away. Flavian Inkuze for CTV, PM Edition.